Greetings, everyone. Big day, important day. One of my heroes. I would say one of the heroes of the heroes, right? In my pantheon, is back with us today, courtesy of our wonderful sponsor, the Wellness Company, and that is Dr. Peter McCullough, MD, MPH, Chief Medical Officer of the Wellness Company, and one of the people who, I always say this when I introduce him, caught my attention in a dramatic way very early in the pandemic and lockdowns, because he was issuing important warnings about the virus at that time, and he was so highly credentialed. He was vice chief of internal medicine at Baylor University Medical Center, a professor at Texas A&M University. He has fought to get the truth out to his patients and to the world ever since the beginning of the pandemic. But before that, he was one of the most published cardiologists in the world. So welcome back. And there's a lot of important news that you want to share with us today. Let's start with why you've got an image of a genetic map behind you, and then let's talk about cancer. Okay.
It's just the times we're living in is just stunning. You turn on the news every day and you just almost can't believe what you're seeing. But thanks so much for the invitation. Great to be back in your pantheon.
You've always been in the pantheon.
You've brought up great images. I remember walking into the pantheon in Europe. But I'm the Chief Scientific Officer of the Wellness Company. I am in practice as a board-certified internist and cardiologist in Dallas, Texas. So I'm seeing patients every day. After this interview, I have a patient coming from out of town. And, the reason why the genetic code is behind me is that in the United States, according to USA Facts, which uses the tabular CDC data, 81% of Americans have taken a COVID vaccine. 81%. Wow. And of those who took the vaccine, 94% took a genetic messenger RNA vaccine, which is the genetic code for the lethal part of the virus called the spike protein.
So say more. What are the implications of that?
Well, think about that. Just that alone, the genetic code for the lethal part of the virus. So, as a scientist, I would have every question under the sun. Well, how do we get rid of that genetic code? Right. Well, it turns out that it was modified in a process called pseudouridination, of which the Nobel Prize was awarded to Carrico and Weisman for this. Mm-hmm. And it's essentially indestructible. There are no published scientific communications showing that the human body can break this genetic code down and get it out of the body. We have a paper that's been published from McCullough Foundation on the European Commission preprint server in my patient, demonstrating the genetic code is circulating, his Pfizer genetic code is circulating in his blood now 3.5 years after his third shot.
And can I just jump in there? How do you test that in your patient? And does that mean, forgive the ignorant question, but does that mean that it's the genetic code to make more spike protein, or does it mean, as I've also read and not fully understood, that that this genetic code integrates into our DNA?
Both. So the genetic code producing more spike protein, as in my patient. Now we use a research lab in Germany, the Inmodia lab, to detect the Pfizer circulating vaccine. And separately, in a paper by Brogna and colleagues, using what's called mass spec, they could identify in about half of people who took Pfizer and Moderna, they could find the vaccine circulating in the bloodstream. So we know it's not just my patient. And the spike protein produced by the vaccine is very different than the spike protein one gets from the infection. The spike protein is the full-length spike protein. It has a proline insert, which holds it open in the prefusion conformation. And then it trimerizes. The spike protein, 3 of them form a triple, and they twist, almost like a twisty tie twisting. And so that circulates in the bloodstream almost like a spear. And it circulates damaging tissues, organs. It penetrates the heart, the brain. It's absolutely horrendous. I spent time with a poor woman, a mother of a family of 7, whose husband took the vaccine, and within hours of taking it, he suffered a massive stroke in the brain. And in a paper by Ota and colleagues, even within a few hours of taking the shot, the blood vessels in the brain can become loaded with the vaccine spike protein, which damages and literally just ruptures the blood vessels.
So this might be an even bigger set of findings than I've understood previously. Have you, in what you just described, identified the mechanism by which all of these symptoms, strokes, blood clots, maybe the weird amyloid fibrous ropes that cadavers are revealing, vaccinated cadavers, people who were vaccinated who are now cadavers, is the tripartite formulation or form that is injuring blood vessels as it moves through the body, injuring tissues, the mechanism for all these horrific side effects?
Right. Well, the first observation is that it's given as a shot in the arm.
Right.
So the body has no defenses like it would with the infection. So if you breathe in the virus, the first thing is your body's mucosal system can fight off the virus.
Right.
The spike protein from the virus, it actually docks with a human receptor called the ACE receptor. Well, there is receptor-mediated clearance of at least part of the spike protein. So the S2 segment is sacrificed there. So the body actually clears it. So now with the infection, you just end up with the tip, which is the S1 segment of the spike protein. And in a paper by Barham and colleagues, using an indirect measurement, which is the antibodies against the spike protein, he found that the antibodies against the spike protein in those who had the infection are far lower than those who took the vaccine. So we would infer that people who took the vaccine are super loaded with the spike protein.
I get it.
And to make matters worse, the vaccine didn't work. It didn't stop COVID. It didn't stop transmission. It did not reduce severe outcomes. So those who took the vaccine, they got the infection anyway.
Right.
So now they've been super loaded with the spike protein.
So early on, I read a scientist who was, of course, smeared and attacked, I don't remember which one, describing the action of the spike protein as being like little razor blades moving through the body. Is that a version of what you just described, this sharp, cutting, injuring shape?
That's almost like a metaphor, but clearly the spike protein is inside cells, it's outside cells, it's expressed on cell surfaces. The one thing for sure is that it's pro-inflammatory. Right. It attracts the body to attack the spike protein. Right. And because the spike protein is everywhere, the body starts attacking itself.
Which explains so many autoimmune disorders, right? And other inflammatory skin problems, eye problems, other inflammatory problems. But it also sounds like you're describing something almost more gross or mechanical as well, that this substance is moving through the circulatory system. I partly ask because I know 2 healthy young people who had blood clots to the brain or strokes.
Well, yeah, for sure. Well, the spike protein clearly is thrombogenic. It's found in the center of these blood clots, and it folds. And when a protein folds, it becomes almost indestructible. The term for this is called amyloid. Right. And there's about 3 dozen proteins before the vaccine that were known to be amyloidogenic. The spike protein is amyloidogenic. And amyloid, I can tell you as a doctor, I'm very experienced in cardiac pathology. When we saw a heart influenced by amyloidosis before the pandemic, the heart would, in an autopsy, the heart would actually bounce like a Super Bowl. So amyloid is rubbery and bouncy, and that's what we're finding with these giant blood clots. And there have been surveys, retired Major Tom Hamlin has done this, and about 70% of individuals who come for embalming the deceased, they have large blood clots form in situ. And normally when the human body dies, the blood liquefies and is easily drained out.
God. So what you're saying, it's like a nightmare. It sounds like this amyloidization will continue to multiply and develop over the course of people's lives as if they've taken this injection. and will continue to cause worse and worse problems and maybe kill them? I mean, is there any plateau? Is there any?
The fair answer is we don't know. To give a brand new genetic product that had no preclinical safety testing to a huge population worldwide, it was the most giant biopharmaceutical blunder of all time.
Right.
To think about this. So of course we don't know. But short term, I think the most difficult thing to grapple with is why are some people fine who take these shots? They don't have any problems, and a smaller fraction are not fine. So let's just nail down this smaller fraction. So in the CDC V-Safe data, where 10 million Americans volunteered to be in this research study, and they were reporting what happened after they took the shot, 7.7% of people who took the shots acutely became so sick they had to go see a doctor or urgent care or be hospitalized. 7.7%. There have been other surveys that nail this down. About 5 to 10% of people who took a vaccine have a problem. 90% are fine. Now, I've examined the Pfizer lot data or batch data where you can identify where a vaccine came from in its manufacturing lot. Pfizer's got about 4,500 lots. About 25% of the lots, somebody has died, reported in a data system somewhere. But 75% of the lots, no one's died.
Wow.
So, I mean, give me an example. My mother-in-law, who's 93, she took 2 Pfizer shots in 2021. She never felt them in her arm. She's never had a side effect. She lives with us. I mean, I'm telling you, I am telling you as a doctor, she is fine after taking these 2 Pfizer shots. So we finally measured her antibodies against the spike protein. Now, the average person who took the shot has, on this test, which you can get through LabCorp, you can self-order it, the average person who took shots with the problem is at 11,000 binding units per milliliter. My mother-in-law, who's perfectly fine, she took the shots, she was 200.
Wow. And how do you explain that? Is it something in her body or something in that lot that was apparent?
It's one of two things. Either my mother-in-law miraculously can clear the vaccine out and other people can't, or what's been shown now, multiple studies, is the lots were different. Some lots, patients had virtually no side effects whatsoever. Right. In fact, what I think happens is very sloppy manufacturing. I think there were some lots that had almost no active messenger RNA in it at all. Right. And I think my mother-in-law got one of them. Right. And then others, I see others whose number on the same test years later is 25,000, and they're racked with blood clots, stroke, hemorrhages, cancers. It's horrible. So, and the only country that's allowed segregation out there fairly has been the Czech Republic. And there it's clear. Among the vaccinated, this has been a nightmare. For instance, the Czech data on fertility has come out, and towards the end of 2021, there was literally a plummeting of fertility among the vaccinated. The unvaccinated were fine.
Right. Well, that's also a very important piece of news that everyone watching who's concerned about a loved one can order a test from LabCorp. And what is the name of the test that they order, please?
It's called, so this is how you do it. If you go to LabCorp, go to Labs on Demand, click Infectious Diseases and Immunity, and select the COVID antibody test. And you get a user ID and password, pay $69, and you can go into LabCorp and get your blood drawn, any LabCorp office in the United States, and can find out what your number is. Now, and we've published on this extensively, any number less than 1,000 is safe.
Wow.
There's never been a problem described in anybody under 1,000. Now, once we get over 1,000, a typical person with long COVID is about 2,500 or so, just, no vaccine, just as, had lingering symptoms. The average person with a vaccine and a complication by the Barham data, 11,000. I'll see somebody today, they could be, 22,000 on this. The implication is if the antibodies are high, the spike protein must be there to keep stimulating the antibodies.
Right.
So if we can get rid of the spike protein, the antibodies will go down. Those who take the vaccine, we actually have to get rid of the vaccine. Now, Pfizer and Moderna are still in the body. Remember the Janssen vaccine, that was an adenoviral vector vaccine. So the vaccine is out of the body with Janssen. It's just now a matter of getting rid of the spike protein. If they took Novavax, it's a matter of getting rid of the spike protein. So the vaccines are different. But I know many people who took Pfizer and Moderna, they are asking, doctor, how do I get the vaccine itself out of the body?
Right. And you're saying we don't have the answer to that? What about, well, you have a formulation that
well, yeah, but let's talk about the vaccine itself. Since human RNA degradative enzymes, are impotent against the pseudo-uridinated Pfizer and Moderna structure, the only thing we can hope for over time is that there's some degradation. A few base pairs falls off, and the liver somehow can capture this and get it out. The liver is probably responsible for getting rid of it. So one attempt is to rev up liver detoxification systems. There are liver detoxification approaches. One principal one is N-acetylcysteine. Another one is milk thistle. There are some natural products that kind of rev up hepatic elimination. So at the Wellness Company, we put together a product called Ultra NAC, specifically to rev up, theoretically, clearance of the vaccine itself out. So Ultra NAC, very important. I've got a picture of it here. It comes in a gray label. That's useful. Okay. And the other thing is the messenger RNA has been found in breast milk in papers by Hannah and colleagues. Well, breast milk is modified sweat. In the paper I described with my patient, we did skin biopsies and we found Pfizer right in his skin. I mean, it's right there at the sweat glands. We think the vaccine comes out in sweat. This is very interesting. So if that's the case, if people actually intentionally sweat, if they go out and exercise, if they go in saunas and have large volumes of sweating, they theoretically could sweat the vaccine out of the body. And that's my theory of why the athletes, after the initial wave of myocarditis sudden deaths that we saw in Europe, the athletes have been fine. If you watch any of the pro sports right now, the athletes seem to be fine. I think they sweated the vaccine out of them.
When incredible doctors start paying attention to purposed medications, it's really worth asking why. Dr. Harvey Risch, who's a friend of mine, I adore him, a friend of mine and Brian's, former professor of epidemiology at Yale, and now serving on the president's cancer panel, is helping lead that conversation. A new groundbreaking observational study from the Wellness Company analyzed the off-label use of ivermectin and mebendazole in nearly 200 cancer patients treated by licensed doctors across cancers such as breast, prostate, lung, and colon cancers. And the results are hard to ignore. After 6 months, 84% of patients experienced clinical benefit, including stable disease, tumor regression, no evidence of disease. This is not lab data. This is real-world patient experience. Dr. Risch, chief epidemiologist at the Wellness Company, called it an exciting signal deserving serious scientific investigation and more accessible, lower-cost cancer care options. God knows. I have some loved ones who are going through cancer treatment right now, and did you know it's the only treatment in which the oncologist gets a cut of the chemotherapy? It's shocking. Perverse incentives. That is why the Wellness Company makes it easy to access an ivermectin and mebendazole formula using medications that are FDA approved for other indications and are being studied for additional use. That's what a second purpose means. It is doctor prescribed and USA compounded, so no weird overseas supply chain, designed to support these patients exploring these emerging approaches under medical guidance. Ordering is simple and fully digital. Just fill out a quick intake form, a licensed doctor reviews it, and your prescription ships directly to your door. Head to dailyclouthealth.com. Again, that's dailyclouthealth.com, and use code DAILYCLOUT to save up to $60 off plus free shipping. You guys have to do it.
This is huge. I so admire the way, just in the last few years, you keep asking, rigorously pursue studies, publish, and then you must have identified, 3 to 5 major insights to keep people healthy or save their lives that we never would have understood without you and your team. And I just really want to thank you.
You know, you're right. The wellness company, every day we come into the office, we think about these things. Our public health agencies have done nothing about this. They haven't raised the question of where is the vaccine in the body?
Right.
How do we get rid of the vaccine? And then the second issue is how to get rid of the spike protein. And there now, this has been 3 years of work here. That's the ultimate spike detox in a wellness company. Now, these are enzymes that are targeting the spike protein itself and dissolving the spike protein, whether it's inside cells or outside cells. That's nattokinase, bromelain, and then other ingredients. So I can tell you at the wellness company, what we've done is we recognize there's a problem. We listened to people. We reviewed the scientific literature. We're publishing now as aggressively as we can. And, our CDC is sitting back with 12,000 scientists, a budget of $9 billion, and they're doing nothing on this.
Extraordinary. And RFK Jr. is in charge of HHS over the CDC. You would think there could be at least questions asked, even if the questions inevitably shine a light on the most nefarious pharmaceutical rollout in history. So this is really hopeful. I'm going to tell, and I know everyone watching is going to tell their loved ones, go sweat it out. And so you would say what red light saunas, exercise, steam baths, everything that could possibly, do red light saunas work to
Yeah,
help
they
you?
do. As long as you sweat. And the red light saunas, the nice thing about them is, they're safe and they're so affordable. People can set these up as little teepees in their house or their apartment. You can get them online. And now at the wellness company, we advise the paired products of the Ultimate Spike Detox and Ultra NAC. In addition, that's my standard recommendation to patients. And we want to see low spike protein levels. At a year, we want to see the antibody level go down by 20%. That means the spike antigen is way down.
Right.
And then ultimately, those antibodies get below 1,000. Importantly, people need to be on a spike detoxification program. All of the cardiac arrests and new blood clots and other problems have occurred, in my experience, in those who don't know about the detox.
Oh, wow.
And so
That was my next question. Are you really finding a correlation between lower levels of spike in these blood tests, detoxification protocols, and fewer symptoms, fewer medical crises?
For sure. In fact, I had a patient write in recently, a follower, and said, "Listen, I was on the detox, and he had a problem with it. He had a blood clot and it went away. And he goes, I stopped the detox, and a blood clot came back."
Oh my gosh!
So remember, the detox, the Ultimate Spike Detox, is a form of a blood thinner itself. Nattokinase and bromelain are blood thinners. Bromelain prolongs the prothrombin time. So these are high-dose medicinal-grade supplements that are given, and patients should tell their doctors that they're taking this. In addition to other drugs that they take, this is a serious undertaking, but this is also a serious problem. The National Institutes of Health has commissioned 0 studies on vaccine or spike detoxification.
Can't
0.
even believe it. What are we even paying taxes for? It just like as you're speaking, I'm just thinking it is crazy that you and I on an independent podcast, are discussing this incredibly important finding of your team, which is underwritten by a wonderful private company and donations, and not by, the billions of dollars that our taxes go to fund the science and the medicine. It's extraordinary. But, thank God for you and the wellness company and what you're doing. I know that people, among other things, people need hope, and they need to know. I was just talking to an elderly friend who has been diagnosed with Parkinson's. And I know that Parkinson's and other tremor-like symptoms, excuse me, pardon me, maybe he would have gotten that organically. But I know there are also symptoms of the vaccine. So I don't know if sweating and detoxification will help him manage his symptoms, but I know that just giving him proven natural support for things like tremor and neurological health and so on, gives him a sense of control and hope, and can make him more comfortable as he's managing his symptoms. So I guess all I'm trying to say is it's not the CDC. You deserve all the funding. You deserve all the 2,000 scientists working under you to ask these questions, get the results, and pursue the additional questions. Like, that's what's so frustrating about this situation, is that you're asking all the questions you can and nailing down the answers with the staff that you have. But the way that institutional science works, there could be other teams asking other questions related to the McCullough protocol and doing other studies, and the literature grows and grows. So that's what we need to get to you all somehow.
But Naomi, I have to make the observation is that this paradox that you just described, it began immediately in 2020 before the vaccines.
What do you mean?
It began immediately. That is, when this virus started to get people sick, I was the only one who published, a high-level, multi-drug, peer-reviewed, step-by-step protocol on how to treat it. You're talking to the person. I mean, this is astounding. I was the lead witness in the U.S. Senate to present the fact that we could treat COVID November 19th of 2020. Insane. So this started in 2020 before the vaccines. It was as if the medical orthodoxy and the National Institutes of Health and all the agencies, and this is true worldwide, as if this was something that was going to be unassailable, that there was going to be incredible institutional malaise on this. Nobody was going to do anything. No one was going to do anything about the virus. No one's going to do anything about the harm of the vaccines. I mean, it's really stunning.
Stunning. Well, not only not do anything, but institutions went after you and engaged in lawfare against you and tried to destroy you.
Like, for what? For treating patients? I mean, I published a paper in the American Journal of Medicine. It's still one of the most cited papers in their journal, in their history. McCullough protocol, which I copyrighted because I'm responsible for it, became the protocol of the Association of American Physicians and Surgeons. Thank goodness one doctor organization strongly supported early treatment. But those who attempted to suppress early treatment now are the same, and we're talking about the medical orthodoxy, all the public health agencies, the presidential administrations, of countries all over the world, were the same ones who promoted mass vaccination, and now the same ones who are suppressing any research on vaccine injuries, disabilities, or death.
I hear you. At the same time, arguably, the damage you're looking at is caused by the virus as well as by the vaccine. So why is it so politically unthinkable for the CDC to do the studies? They could be studying spike protein that got into people's bodies organically through the virus.
There was investigation. The Biden administration and HHS under Xavier Becerra had a long COVID research program.
Interesting.
They said, well, people are kind of sick after they have COVID. They've invested $1 billion in this. Listen, $1 billion. Not in a single study did they examine the spike protein, which is the cause of these syndromes. The word spike doesn't even come up in their request for applications or any of their projects. And not in a single one did they study the effect of the vaccines making long COVID worse. So guess what? That $1 billion produced 0 protocols, 0 therapeutics, and 0 diagnostics. It was a complete waste. And and universities like Harvard and Columbia, all these prestigious universities had long COVID research programs. They produced nothing because they didn't study the root of the problem.
This is particularly, I shouldn't say unbelievable because the corruption doesn't surprise me anymore, but particularly infuriating because I did want to share with you that since we last spoke, actually just in the last week, I reposted and re-reviewed an 8-page CV by someone named Dr. Eric Donaldson, who was Dr. Ralph Barrick's lieutenant at UNC. Mm-hmm. And what I saw is that they were studying gain-of-function weaponization of bat coronaviruses in America for 12 years before 2020. It was funded by Dr. Fauci. They had research sites all over the United States, including Maryland, Montana, and the northeastern United States. So they were weaponizing the virus in bat feces and modeling it, reproducing it, and then modeling crossover from the animal to the human population, and modeling a pandemic, and then modeling an RNA-based vaccine. All of this was happening in the United States. Then Dr. Donaldson got placed at FDA, and in 2020, he rubber stamped remdesivir, which killed, of course, thousands of people, and those deaths were attributed to COVID. The reason I mention this is that some of his studies, like 2009, 10, 11, 12, 13, 14, looked at spike and at ACE receptors. So I guess what I'm trying to ask you as a non-scientist is, given that record of the government funding that research in the United States, how could the government not study the damage of spike? They knew it was the spike.
They knew. It's overwhelming. Listen, there are thousands of papers on the spike protein. I've published over 100 peer-reviewed manuscripts on treating the infection and now managing the COVID vaccine syndromes. And this is in the peer-reviewed published literature. I can tell you, I haven't been invited to give a single grand rounds in the country on this. Not a single one. And I've checked with my colleagues at institutions. They have 0 lectures on long COVID, 0 on vaccine injury syndromes. There's a whitewashing of this. When I get my New England Journal of Medicine or JAMA or anyone at Lancet, any one of these journals, there is a complete whitewashing in this. I asked artificial intelligence, let's just take the vaccines, and take the major journals, New England Journal of Medicine, Lancet, and JAMA. And I said, how many papers have concluded the benefits outweigh the risks with COVID vaccines? How many papers have been published in the major literature? The answer, around 400 or so. I said, well, how many have concluded the opposite, that the dangers outweigh the theoretical benefits? 0. Well, let me tell you, in medicine, there's always a balance. If you did the same thing with statins, for instance, you'd find, well, there's so many papers concluding statins, the benefits, but you have other ones saying, well, we think the risks are here. Or with back pain surgery, or with any other form, antidepressants, you can go through anything. There's always a balance. It's never 400 to 0.
Right.
Okay, so, and there's hundreds of papers, by the way, who have concluded the risks of vaccination far outweigh theoretical benefits. They are intentionally suppressed out of the high-level journals. I've published in New England Journal of Medicine. I've published in JAMA and Lancet. I'm kind of, as an author, worthy of having my work published there. No dice when it comes to spike protein, treating the infection, or vaccines.
So you submit these papers and are ignored, or they're rejected, or?
Yeah, they're many times rejected out of hand. Literally, the associate editor will look at it, not even a doctor, and will say, "No, I'm not interested. We're going to pass on this."
Do you give a reason?
No, many times it's just we don't think it's a fit for the journal. So that's called a desk rejection. We've had it there. We've had our papers come in, and the editor says, "Well, let's give it a shot." And they'll distribute it to associate editors to then marshal the paper. We've had associate editors say, "We refuse to handle this paper."
They don't say why.
And it's never happened. I'm the editor of a major journal right now. I've never had an associate editor refuse to handle a paper. Then when the paper finally gets to peer review, we've had peer reviewers violently disagree. No, they said this paper could lead to vaccine hesitancy. We can't possibly let this paper get published. The vaccine hesitancy is viewed as a psychological villain out there. We don't want that to creep into people.
Can I just jump in and ask something, based on just pure academics? Aren't those journals not supposed to be advocates for one outcome or another? They're supposed to just report the science, right?
They're supposed to be fair balanced. Sure, there's the Committee on Publication Ethics, COPE, that says there should be, but when it comes to vaccines, there is no fair balance. So there's a general editorial policy that things that are favorable to vaccines, and this is true of all vaccines, by the way, those get into publication. Anything that is showing harm, because it will contribute to vaccine hesitancy.
But that's not their job to worry about vaccine
I know, but listen, the World Health Organization has said vaccine hesitancy is a major threat to public health, and our CDC says that too. So vaccine hesitancy, the thought, is itself considered to be a disease.
Oh my gosh.
In fact, I published a paper on this in the European Society of Medicine, and I was able to find 20 different scientific instruments, surveys, and other assessments of vaccine hesitancy, just like it's a disease, like it's schizophrenia or depression or some psychiatric disease. Do you know there's the Oxford COVID-19 vaccine hesitancy scale? And if you're a participant and you score high in vaccine hesitancy, you're considered to be, diseased.
Oh my gosh.
Remember, in Canada, during the time of this controversy, there were some doctors who refused to take the vaccine. And remember, the Canadian authorities referred them for psychological counseling.
Unbelievable. And what would happen to science and medicine? Well, I guess it's happening, but over the last 400 years, if people had said, well, I'm not sure that we aren't infecting women who are giving birth with bacteria on our hands, maybe we should wash our hands. Oh, that's a psychiatric disorder that you think we need to wash our hands before attending women in childbirth. I mean, science would not progress if there were unaskable questions or medicalized or pathologized skepticism.
But I want to follow this progression of publications since I've been through it so many times.
Yeah.
So when we finally get a paper, and the reviewers say, listen, well, here's all the threats to validity. Please address these issues. And we address all the issues, and we modify the paper to satisfy everyone. We satisfy the editors. And there's finally an acceptance. It says, okay, this paper's been accepted for publication in a peer-reviewed literature. We go through contracting, copyright, color figures, reprints. We spend thousands of dollars. A typical author spends about $6,000 per paper of our own money to publish a paper in a journal. But when it's published, it's listed in the National Library of Medicine, Google Scholar, Scopus, Index Medicus. So it's part of medical history. Right. So we've gone through this process, have a paper published, and then get tremendous attention, hundreds of thousands of downloads, people are reading it. And then the journal, a month or two later, sometimes a few years later, will say, we're retracting the paper. And we'll say, well, on what basis? The journal had the chance to reject it, multiple times. It's part of medical history. How is it now being retracted? God. And the answer would be, well, just for administrative reasons. There was a problem in one of your references. And then we have appealed that decision. So wait a minute, it's not fair. We cite the Committee on Publication Ethics Guidelines. They said, sorry, you lose your money, you lose everything. This paper is no longer a valid paper. It's retracted.
And reputationally,
then it's forever listed in the National Library of Medicine as retracted. Meaning it's actually it's a blemish. And I was an editor for over 2 decades of major journals. I can tell you, I never retracted a paper, ever. Right. I was never asked by the publisher to retract a paper, ever.
Well, I mean, they're telling on themselves, right? Because if they feel the need to retract, it means their vetting procedure, their editorial procedure is at fault. But I personally think this is just a setup, to assign you those blemishes.
Well, no, I think it's something different. What investigations have found is that once these are published, the journal's happy, the publisher's happy, life is moving on. External forces are at work. They start to apply pressure to the publisher, and the publisher may tell the editor, listen, you need to pull this paper, find a reason. We know this because I was on a paper with Stephanie Senoff, and the journal was Food Toxicology and something else. It was the name of the journal, and the editor got involved in this. He said, listen, I'm getting pressure from the publisher to retract the paper. It's a valid paper. I won't do it. And they told me I'm going to lose my job as the editor, and he lost his job. So it's an external force. It's not coming from the editors. It's an external force. And I can tell you, this now has been analyzed itself. So papers on early treatment of the virus and papers on vaccine injuries, disabilities, and deaths, and vaccines on ways to handle these problems are disproportionately retracted after publication. Papers that claim the vaccines are beneficial or claim that the virus is bad and unassailable None of those papers are retracted.
Look what's in the New York Times, I think yesterday, a big story. Initially, I misread the headline. I thought, oh, they're finally covering it. A big story on how the FDA prevented a release of studies on the COVID vaccine. And I thought, oh, finally, we're going to get some attention on how, the agency censored the damages of the vaccine. But no, they're claiming that the government agencies prevented research showing that it was safe and effective from.
They've twisted it. And, I'm familiar with the backstory here. Remember, for claims of efficacy, like a vaccine does something, the study must be randomized, double-blind, placebo-controlled trial. It can't just be an observational study because, and in this case, it was just an observational study because the observational study doesn't take into account who already had the infection as natural immunity, doesn't take into account who got early treatment, like McCullough protocol, that would have saved lives. And it doesn't take into account if they had a milder form of the virus, like the Omicron strain versus the original wild type strain. So because of that, it wasn't a valid study. Responsible people like Jay Bhattacharya, who's the acting director of the CDC, and others said, listen, no, it's not a valid study. We're not letting it get out. The press got a hold of that and said, oh, they're suppressing important information. So I have to tell you, we're in a time of great controversy. I can tell you, as one of the most published, I'm clearly the most published scientist in this whole pandemic field for sure. Totally. I've never seen anything like it. And the net result is people are being deceived and people are unnecessarily suffering.
Indeed. I mean, I spoke to scientists about these issues this past week, and they legitimately had no idea about some of the things that the medical freedom community understands now fully, thanks to work of people like you and your rare, brave colleagues. I hate to pivot, but I also need to know about what you're doing at TWC related to cancer and treating cancer with alternative protocols or methods. Can you talk a little about that?
Well, the pandemic, as a great kind of human endeavor or misadventure, if you will, just like the space program or anything else, ought to have spinoffs, right? So if the whole world goes through something, invariably some innovation comes out of it. And here is the spinoff. One of the drugs that became the most widely used drug to manage acute COVID-19, rapidly working, very safe, was ivermectin, an anti-infective. There had been years of preclinical data suggesting, listen, in addition to anti-infective properties, because it's multidimensional drug, it may have anti-cancer, anti-neoplastic properties. Separately, a drug, also an anti-infective, mebendazole, that also looked like it had anti-cancer properties too, because these are drugs that go inside cells. They, separately have been shown to kind of reduce the proliferation of cancer cells, restrict the blood supply that the cancer cell is trying to command, and then cause the cancer cells to give up and fold and be cleared out in a process called apoptosis. Both of those had shown this in preclinical studies. Ivermectin was already in a cancer protocol for breast cancer at UCLA and Cedars-Sinai in recent years, and Johns Hopkins had already written a patent on mebendazole for brain cancers. At the Wellness Company, we combined them in a micronized formula, mebendazole and ivermectin, for an FDA on-label use to treat parasitic infections, but we kept track of patients and why they wanted it, and we had patients who wanted it as an adjunct to treat cancer. They were making that decision, in conjunction with their cancer doctors. They were getting it from the Wellness Company. We kept track, and we were astounded with what we found.
Really? Tell me, what did you find?
It was stunning. So I can tell you that 84% had some benefit. So if the cancer was in remission, it stayed in remission. Those where the cancer was advancing, it either halted or it actually improved. The cancer regressed. Only 16% of patients had progression. This is by their report. 25% had some side effects, but 94% of them could actually stay on the drug. And so it was very safe. And now there's no control group, so this is not a therapeutic claim, but it's a very bright ray of hope that these two generic drugs. Now remember, some other cancer drugs, are biologics, and they're used, for their anti-cancer properties. The most prominent one is Taxol, which is derived from the yew tree. Ivermectin is actually derived from the soil in Japan. So, here we go. Could we actually have a product that is anti-cancer? And this is the strongest call. Please, can those in the administration, and we know they all are on our feed, by the way, they all read the focal points, which is our feed, and we can actually see who's reading the releases. So we know that they know that we have such a positive result. This is perfectly set up for the National Institutes of Health and the National Cancer Institute to do a large prospective double-blind randomized placebo-controlled trial of combined ivermectin and bendazole.
Wow, that is amazing. And can you estimate, when you say we're keeping track of people, it's, it's not a pure whatever double-blind study, but it's observational is what you're saying. It's people reporting their outcomes. What is the sample at this point? Hundreds, dozens?
Well, the sample at the 6-month point where we have all the baseline and follow-up data is 122. The number is closer to 200 that's in the total group. So that group is going to pass the 6-month point, and then we're going to go on to 12, 18, and 24 months. And so at that point in time, we need to extract, all of the scans and PET scans. Patients characteristically with cancer undergo what's called restaging every 3 months. So this 6-month was a fair window to assess. Now, we did a press release. We have a manuscript that's on the European Commission preprint server, and the full manuscript now has been fully accepted to a high-level peer-reviewed cancer journal.
Amazing.
Now, I will be very interested to see if this faces the same retraction pressure that things in the COVID sphere face. So I can tell you on social media, that may be a proxy, when we got this out in social media, we almost had the same kind of adverse headwinds. Oh, this doesn't work. No, this shouldn't offer any hope to anybody. No, this is wrong. Well, wait a minute. This is just an observation. This should be a very hopeful story. Why are people so vitriolically against an advance of generic therapy for cancer?
But I'm sure you know better than I the history of what happens to promising treatments for cancer that are outside of the allopathic model of chemotherapy, right? People are run out of town, they face lawfare, they are smeared, their reputations are destroyed. I mean, this has gone on for decades. So,
well, you tapped on something that I think is perverse and insidious. Let me just say, as an internist and cardiologist, 90% of the drugs I prescribe are generic drugs. They're very affordable. Some of them are $3 to $10 a month. Over 90%. Do you know what percent of cancer drugs are generic and affordable and available?
Zero. Oh my God. Well, it's worse, right, Dr. McCullough? As bad as that is, don't oncologists get an incentive of prescribing chemotherapy because they get a cut, which is like the most perverse, unethical incentive I've ever heard of?
It's beyond belief. It's called book and bill. So if the cancer centers administer the therapy, they get a percentage of the revenue. So the more expensive therapy they prescribe, they actually get a bigger dollar amount.
Horrible.
So it's a completely perverse incentive. Come on. Cancer and heart disease are the neck and neck as the two leading killers. Why in heart disease do we have all these generically available drugs we can use and why is it cancer? There's nothing. Nobody can go to the pharmacy and get any drug to treat cancer. This is astounding.
Extraordinary. Well, this is huge news, and I'm very excited to see what happens next. Now, if people are listening to this and they unfortunately have a diagnosis of cancer, is your observational study or your review of this self-reported evidence open to new patients who want to join and be part of it?
For sure. So patients can go to twc.health, use your code, and for your show. What's your code, Naomi? Do you have one?
Yes, well, it's not a code. It's dailyclouthealth.com.
Okay,
and use
there we
code
go.
DailyClout. I'm sorry. Yes, use code DailyClout.
Yeah, DailyClout. So kind of get into the system, navigate to ivermectin and bendazole, and then there's an intake form. People have to sign up and what type of cancer and where they are, and they have the doctor approve it. Now, it has to be safe. given that patient's configuration of drugs, review it with their cancer doctor. But there's 20 million Americans with cancer. They're doing everything they can with surgery, chemotherapy, radiation. This falls into the category of why not? We're going to continue the observations here, and this group will build over time. Dr. Harvey Risch, who's on our chief medical board, he's actually the chairman of President Trump's cancer panel.
It's amazing.
Yes,
It's
so
amazing.
Harvey Risch is overseeing this. I mean, this is as good as you get. I'm telling you, if you have cancer, go to the wellness company, go through the Daily Clout, use Daily Clout as your promo code, get signed up. Why not? You can actually help humanity with better understand what's going on and give you the best shot for cancer.
This is very, very exciting indeed. And what a blessing it will be if you continue to see positive outcomes. Those are very high numbers of people reporting. It's over 80% of very high result. I mean, I don't think most people who do chemo know that it gives you, I gather, 3 months longer.
It's very marginal. And listen, this is adjunctively. Now, this is not making a therapeutic claim. This is given adjunctively to everything else. But I have to tell you, even for a cancer cohort to do this well with conventional treatment is really good. And there was only about 16% of people where the cancer advanced. Now, the average person going to a cancer center, the majority of them, sadly, the cancer is advancing. You go from staging to staging to staging, and it gets worse and worse and worse, and then ultimately they succumb. So I think it's a combination. So it's 2 drugs, 3 different mechanisms of action working separately at these major aspects of cancer control. Now, we studied in men, it was largely prostate cancer, women largely breast, and then in both genders, mainly lungs. So they were solid organ cancers.
Right.
So what's needed now by the National Cancer Institute is dose ranging. Can we go up in doses, dose duration, cancer type? This is, just like our work with the spike protein, this is right down the middle for these centers have multi-billion-dollar budgets. Let's see if they do anything.
Right. Well, thank God you're doing this work. So we've come sadly to the end of our time together, but I know that people watching want not just to get their hands on these products from the wellness company, which they should, but also they want to know how to support you and your team and your incredibly important work, which benefits all of humanity. How do they do that, Dr. McCullough?
Well, thank you. Again, for wellness company, twc.health, use Daily Clout as the promo code. McCullough Foundation is mcculloughfnd.org. McCullough Foundation is the not-for-profit research arm of these activities. Those who want an appointment with me, it's petermcculloughmd.com, and then patients come from all over the country. Check out our books, Vaccines, Mythology, Ideology, and Reality. That's a New York Times bestseller. I know you had a chance to preview that. Yeah, that one within a month made New York Times bestseller list. We have
huge.
Courage to Face COVID-19, McCullough Report on America Out Loud News, and of course, The Focal Points, which is now considered the top biomedical Substack in the world. Everything we're doing is top shelf because we are filling this unmet need right now until the orthodoxy becomes aware of what's happened. We have to fill the gap.
Absolutely. I'm a passionate subscriber to Focal Points and an avid consumer of your books. Congratulations on making the New York Times bestselling list. That must, they never let books like yours hit the list. So you must have sold a ton of copies. And everyone listening, if you need to be empowered with your health in facing all of these challenges or the specific ones Dr. McCullough spoke about, please support the McCullough Foundation. Order these products from dailyclouthealth.com, promo code dailyclout, to save up to $60 off plus free shipping. And after I say goodbye to Dr. McCullough, I'm going to thank our sponsors in a more detailed way. But thank you, Dr. McCullough. Honestly, you're such a gift to humanity. Thank you so much for spending time with us again.
Thank you.
Well, you guys, big news. And I know you want to know more about that cancer protocol. When credible doctors start paying attention to repurposed medications, it's worth asking why. Dr. Harvey Risch, our good friend, we love him and his wife, former professor of epidemiology at Yale and now serving on the president's cancer panel, is helping lead that conversation. A new groundbreaking observational study from the Wellness Company analyzed the off-label use of ivermectin and mebendazole in nearly 200 cancer patients. That's what Dr. McCullough was talking about, across cancers such as breast, prostate, lung, and colon. And the results are hard to ignore. After 6 months, 84% of patients experienced clinical benefit, including stable disease, tumor regression, or no evidence of disease. This is not lab data. This is real-world patient experience. Dr. Risch, chief epidemiologist at the Wellness Company, called it an exciting signal deserving serious scientific investigation and more accessible, lower-cost cancer care options. That is why the Wellness Company makes it easy to access an ivermectin plus mebendazole formula using medications that are FDA approved for other indications and are being studied for additional use. It is doctor prescribed and USA compounded, designed to support patients exploring these emerging approaches under medical guidance. Ordering is simple and fully digital. Just fill out a quick intake form. A licensed doctor reviews it, and your prescription ships directly to your door. Head to dailyclouthealth.com, dailyclouthealth.com, and use code DAILYCLOUT, DAILYCLOUT, to save up to $60 off plus free shipping. Thank you so much, the Wellness Company, our wonderful sponsor. We're so proud of their sponsorship for our work and for this important interview. And remember, you guys, it takes a team to get these interviews out there, and we need your support. So go over to Substack and subscribe to Outspoken. Go to Daily Clout and subscribe to Daily Clout. And you can also give one-time donations in addition to your subscriptions over there. Thank you, everyone. This is Outspoken, and Naomi Wolf, and I will see you soon.